The public health system is bracing to deal with thousands of additional sick people should COVID-19 reach Jamaica. $2 billion has been set aside to bolster the system. In the meantime, an aggressive sensitization program on proper hygiene is to be rolled out. More from Dwayne Anderson.
A near $2 billion response plan is in place should COVID-19 reach Jamaica. And a large chunk of that money will be spent in the health sector due to the strain it could come under. Health Minister Dr. Christopher Tufton said an assessment has been done and health facilities could be asked to respond to tens of thousands of additional persons seeking health care.
Some 800,000 will seek medical care in public and private facilities. At the height of the outbreak, we could see as much as 35,000 or so people seeking care within a given week. Close to 50% of the more than 800,000 persons we expect to access care in our public health facilities. At the height of the outbreak, we could see approximately 16,000 persons in a week. Further, just about 2,000 of the cases visiting public health facilities we anticipate will experience severe acute respiratory infection requiring hospital care. And of this number, some 360 will require critical care.
But that's all if. So while the virus is not in Jamaica, the authorities will try to keep it out. So far, travel restrictions have been imposed on 5 countries: Singapore, China, South Korea, Italy, and Iran. The minister insists the authorities will ban countries as the need arises. Funds will also be spent to sensitize the public about the importance of proper hygiene.
The success of our efforts is contingent on the support of all Jamaicans, including the deliberate efforts to access and share accurate information on the virus, thus helping to minimize the fears and anxiety that has been associated with the spread of the COVID-19. At the same time, we must, in keeping with good hygiene, maintain a distance of at least 2 meters from persons who are coughing or sneezing, frequently perform hand hygiene by washing hands thoroughly with soap and water or using a hand sanitizer if hands are not visibly soiled, cover our mouths and noses when coughing or sneezing with a tissue and then discarding it, and avoid touching our faces and each other unnecessarily.
The COVID-19 response plan received the approval of Prime Minister Andrew Holness following a meeting with the National Disaster Risk Management Council last week. Dwayne Anderson, TVJ News.